Today, we're talking with Dr. Sheldon Rubin. Dr. Rubin is a longtime veterinarian here in the Chicago area. He built one of the largest and most prestigious veterinary practices in Chicago. And many of you have seen him, no doubt, on television. He appeared on Oprah, on the Today Show, on numerous national programs, and virtually every media outlet in Chicago numerous times. Dr. Rubin is the past president of the American Heartworm Society. He is the author of numerous books on pet care, and he's an all-around great guy. So let's hear what Dr. Rubin has to say about heartworm disease and our pets.
Thank you for inviting me, Virginia. I'm really happy to, maybe this is the inaugural podcast for Corey's Corner.
Not not quite, but
Not
certainly
quite.
one of the early
Okay.
ones, and we're so happy to have you. Heartworm disease. Maybe we should start out with talking about what it is.
Well, I want to try to make this as simple as possible. Heartworm disease is a deadly disease that affects dogs, cats, and ferrets, as an example. Um, it is transmitted by mosquito, an infected mosquito. And Virginia, there are about 3,500 species of mosquitoes in the world. The important thing about this is that the bite of a mosquito to a dog or cat or ferret that's infected, a mosquito that's infected, uh, with that specific sucking the blood, and if it's an infected mosquito, like I just said, that animal will have heartworm. It's not like, maybe it will happen. It happens. If that mosquito is infected, then it bites your dog or your cat. That those both of those animals will develop heartworm. And it's transmitted from mosquito in a very small, we call microfilaria form. And that circulates in the body and then ends up growing in the vessels of the lungs and the heart to foot-long worms. And that whole process takes about 7 months. And then those worms, you know, pass microfilaria into the blood. These are the baby heartworms. And the mosquito bites that animal, and then inside the mosquito, that larvae, which is that little microfilaria that was sucked up, molts to an infective stage, which we call the larval stage 3. And then that infective 3 that's circulating in a dog or a cat, when a mosquito bites that dog, it the cycle goes on. So I just came back from the triennial uh, heartworm symposium. Every 3 years we have a international symposium, and people come from all over the world that are doing research on heartworms. And it's very interesting because each time we have this symposium, we learn about new things that are happening. And I always say to people that no matter how much you learn, it just shows how much you don't know. And this was very, very typical with heartworm. It's a very complex disease, complex parasite. It's a very interesting parasite, and I'm very pleased to be able to be on today to discuss that with you, and maybe we can get more people to realize how important it is and how their animals should be on heartworm preventive.
Okay. So you mentioned that this was an international symposium. So heartworm disease is a global problem, not just a US problem. Is that
Pretty
correct?
much all over the world and in all of our 50 states, even Alaska.
Oh, okay.
We'll talk about that
Okay.
later. But yes, it's pretty much there are very few areas where there's not heartworm.
Okay. And have we seen a change in heartworm disease? I thought when I was younger, I don't recall this being a big topic. Um, but
Well,
then again,
the American Heartworm Society was founded in 1974.
okay.
So uh, true, I don't think there was a lot that we knew about heartworm. It was founded by a group of veterinarians in Florida that decided that this is a serious problem that they're seeing, and they should form an association dedicated to research and to supporting information education for veterinarians, particularly. And then as we got more involved with it, also to educate the public about it.
And you mentioned it was started in Florida. I was under the impression that initially this was a problem more in the southern states where the weather tends to be warmer year round. Um, in fact, it seems to me that when I first started being responsible for a dog as an adult, that we gave heartworm disease during or preventive medications during the summer months,
That's right.
spring and
We,
summer. And
oh,
now
we,
that's
that's
changed.
true. No, you're right. We used to recommend, and even I recommended before I knew the more details as research went on, that you give the heartworm during the warm season, like up in our area. Okay, so in areas where there's temperate temperatures all year round, you would give heartworm medication every month. But up here in the Chicago area and Illinois, we recommended many years ago that heartworm medication only be given during the warm spring, summer, and early fall time. So in the winter time, we didn't recommend that you gave heartworm medicine. That's all changed. And the reason that's changed is because of, well, a lot of things. One is global warming, which is definitely an issue. Areas that were getting into temperatures that were unbearable are not that way anymore. We have these microclimates that we've developed all over, and I'll use the United States just as an example. Like in Arizona, well, people say, well, it's all desert. There's no mosquitoes there. But the fact of the matter is, we have golf courses, we have irrigation, we have all sorts of things. Cities have grown. All sorts of things have increased the what we call the microclimate of that area. And yes, now there are lots of mosquitoes. And one of the primary carriers of mosquitoes is the coyote. And Arizona has a very high coyote population. Don't forget, we're not preventing heartworm in these wild animals, in this wildlife, but nevertheless, they are reservoirs. So that if a mosquito, and I use Arizona as an example, bites an infected coyote, and then comes over, and when the larvae uh, develop within the mosquito, and then comes over and bites your dog, or you know your dog's going to have heartworm. And
Right.
so yes, we see heartworm all over. And there used to be, and the Heartworm Association sends out a survey every 3 years also to veterinarians all over the United States. It's a very simple survey. How many animals have you checked and in the last year, and how many were positive, and et cetera, et cetera. That number has been going up. We estimate that right now there's probably over 1 million pets in the United States that have heartworm right now. We want everybody in the United States, regardless of where you live, even in Alaska, to treat every month, 12 months a year. Every dog, every month, 12 months a year. Same thing for cats. And we'll talk about cats later.
Okay. And so let's talk about what it looks like when a dog or a cat or a ferret develops heartworm disease.
Well, initially, and this is what's so interesting about this parasite, initially, you won't know it. There is no way to know that your dog has heartworm. But if it becomes a problem, as I just said before, that the worms actually grow in the heart vessels and the vessels that supply the lungs. And when these heartworms begin to grow to these sometimes 12-inch long worms, and if you have, we've seen dogs with 100 worms in there, you begin to see signs of heart failure, lots of coughing, lethargy, loss of appetite. Any of those things could be a reason for many, many different diseases in animals. But it's important to put that on the top of the list of when your veterinarian is checking your dog to run the tests that are appropriate to rule out heartworm disease. Um, the South sees a lot of them. I mean, I have friends in Mississippi that will treat 200 dogs a year for heartworm. And
Gosh.
those are only the dogs that get to the veterinarian. I always say that the veterinarian is the other family doctor, and it's important that people go and see them.
Well, I like to say that the dog is our best friend, but really the veterinarian is the dog's best friend.
That's right.
Um,
Well, the other best friend, yeah.
yeah,
So
yeah. So I think, one of the things you mentioned about heart, so you've told us how animal reacts when they get heartworm disease. Many times when pets get parasites, they're treated with a simple pill for a few days and clears out the problem. Um, is that the case with heartworm? How do we treat heartworm disease? Let's start with
well,
dogs, but I know cats and ferrets might be different.
prevention for heartworm is a very simple process. The cost for prevention, if you're a big coffee drinker, per day is less than the cost of one or two drinks from a fancy coffee place. Um, and the medications that we have for prevention are 99% effective in prevention of heartworm. They come in an oral form, they come in a topical form, and we now have an injectable form where you get 6 to 12 months of protection depending on the injection you give for heartworm. Now, a lot of the oral and topical medications that are available also prevent fleas, ticks, prevent roundworms, hookworms, whipworms, and now even tapeworms with one simple chewable medication that you give on a monthly basis. It's that simple, and it includes the heartworm prevention at the same time. So the problem we have is that compliance is a huge issue. So if I give you a packet of 12 preventable to 12 heartworm preventions, rather preventative pills, um, and you don't give it every month, you might as well not give it at all, because if your dog is infected, if there are mosquitoes in your area and you miss a month of protection, uh, it's likely that your dog may pick up heartworm. It's that if it goes outside. I mean, and obviously dogs go outside. I mean, there's no question about it. And mosquitoes come in the house. There's no reason to believe that this is just an outside problem.
So let me ask
Prevention
you,
prevention is inexpensive. Treatment can cost thousands.
before we get into treatment, let's talk about, I've got it on my calendar, first of the month, got the little sticker that comes with the heartworm medication to give my dog heartworm medication. I was out of town on the first of the month, and the person the dog was with did not give them the medication. What do I do? Do I wait till the next month? Do I not give it? Do I need to go back to the veterinarian to test first? What should be our plan if you miss the
It's an
date?
excellent question, because it's commonly said, "Oh, my husband is in charge of it, and I forgot," or and he forgot. Um, if you miss, if you're giving monthly, if you're giving monthly and you miss a treatment, um, you need to give it. So heartworm medication is part of a class of drugs that is extremely safe and non-toxic to dogs and cats for that matter. And so if you miss 2 weeks and you give it, and then you go back on your regular schedule the next month, and start right away on giving the pill again. But if you miss the whole month, then you need to have your dog checked in 4 to 6 months to make sure that we didn't pick up heartworm. Normally, we check dogs every year. On your annual exam with your veterinarian, that's the time to get the blood check for heartworm. It's very important that you understand that just because, if you think you missed a month, that your dog's going to be fine, it's not if there are mosquitoes in your area that are carrying heartworm. It's that simple. So, yes, you do catch up, give your medication as you should, and then make sure that in 6 months instead of the year, you make sure that you get a blood check for heartworm.
Okay, great. Excellent to know. Now, you raised the issue that I've heard you say so many times over the years. Prevention is inexpensive, treatment is very expensive and difficult. So can we talk a little bit about what the treatment for heartworm disease is? And if you want to talk about the different species, that'd be great.
Well, the gold standard for treatment, the American Heartworm Society has developed a whole treatment protocol based on all the research that's been done all over the world and has been most successful in saving our animals. It's all free online at American Society at the heartwormsociety.org. That's the website. It's written very nicely for the veterinarian, and it's also written very easily for the pet owner. And that treatment protocol is pretty much utilized throughout the world. Every place uses the same treatment protocol if the drugs are available. So, how do we treat heartworm? Basically, we start out uh, by the testing, of course, and confirming that the animal is positive. So one positive test does not necessarily mean the dog is really positive. So all veterinarians, if your dog comes up positive on maybe they're running the test in their clinic. If that comes up positive, it needs to be checked a second time, uh, either at a reference lab or with a different test to make sure that yes, your animal does have heartworm. You can always have um, a false positive. You can also have a false negative.
Okay.
And so whenever anything comes up now, if an animal came into my practice when I was practicing, and I suspected heartworm because maybe the animal was having signs of heart disease, and I took X-rays, or I did an ultrasound of the heart, or I did other ancillary types of treatment, and it looks very suggestive. And the animal's coming in, and I run the test, and the test is negative. I would send that test out to a laboratory to be rechecked and maybe get a fresh blood sample. We have found that from studies that there is a certain percentage of dogs that when you test them and they're positive will come up negative on the test, on the blood test. And there is the antigen is the protein that the test picks up. But we also in our body have antibodies, you and I and our pets. Antibodies are the cellular equivalent of medicine, let's say. It goes right to the source of the strange protein that's in our system and tries to destroy it. Well, there's what we call an antigen antibody complex that forms in some of these dogs. So the antibody binds to the antigen, and the test won't show the antigen. And so what we've developed, and I don't mean we, but what research has shown, that the best way to solve that problem is to heat treat the blood. And if you heat treat the blood, the antibody and antigen separate, and then you get a true reading of the test. Um, that's not a routine that you do for every animal,
Right.
but it is suggested for those animals that the veterinarian suspects heartworm, but the test is negative. And when you send it out, you ask for it to be heat treated in that way. And all of this stuff, by the way, all this information came out of shelter studies. Um, in Florida, for instance, they tested, maybe 200, 300 dogs that came through the shelter there. And all of those that came up negative for heartworm on the routine test were they sent those out to be heat treated to see. And as high as 10% of those animals came back positive. So while
Wow.
it looked like they were negative, they were really positive. So as you can see, this is becoming a very complex issue. And I don't mean to confuse everybody. And that's why you need to rely on your veterinarian. This is not something you do at home. You have to have your veterinarian do all this, and they will guide you in the process if for some reason there's any discordant results. In other words, the animal looks like it has heartworm and the test shows heartworm, but when you really do the antigen test, it's negative. So there are lots of things to think about, and we've learned an awful lot.
Okay. And so your dog or cat has heartworm. What's the treatment?
Well, let's go back to a cat for a minute because you mentioned it. Okay. Um, Cats are what we call end hosts. In other words, if a cat gets heartworm, and by the way, one bite from an infected mosquito will infect cats. And if your cat goes outside or sits out on your balcony in the Chicago area and a mosquito that is infected bites them, they're going to have heartworm. They're going to get heartworm. But when it's an end host, it means that the heartworm doesn't develop onto that in that cat to infect another animal if a mosquito bites the cat. Now, the sad things about heartworm, now you may only have in a cat somewhere between 2 to 4 adult heartworms in the cat. Sad thing about cats is that they show signs, and probably what we've misdiagnosed in half of them as like asthma. And it's called there's an acronym for it. It's called HARD, HARD, and it stands for heartworm associated respiratory disease. So a lot of times, and I can think of a lot of animals that I've seen, cats, that have come in with signs of asthma, and we treated it asthma. And eventually, over time, they get better, whether they have an inhaler or put them on some cortisone to cut the inflammation or something like that, they got better. And we never tested them for heartworm, so we didn't know. But now, if a cat comes in with signs of asthma, um, they should be tested. And the test for a cat is different than it is for a dog uh, because we need to do an antibody test to see what the antibody numbers are in the cat, because if the cat was infected or is infected, the antibody count will be high. And also, we need to do an antigen test, and then we can treat appropriately. The sad thing is, and I want to make sure everybody understands that, there is no treatment for cats. You treat the secondary problems that you see with support for the breathing, and oftentimes the sign of heartworm in a cat is sudden death. So that's
Wow.
very important that people know that. In the dog, it's a different process. We have a very intense process, gold standard treatment method that we use. Uh, the drug is called melarsamine. It's a 3 injection product. So the dog comes in, it's positive. For heartworm, it started immediately if it hasn't been on their monthly heartworm prevention. Uh, and at the same time, it's given an antibiotic. It's doxycycline for 30 days. Why do we use doxycycline? Because on the adult heartworm, there is a bacteria called Wolbachia. Wolbachia. All of these types of worms have Wolbachia. They're symbiotic organisms. They give something to the heartworm, and the heartworm gives something back to them, and that's how they live. So, but without the Wolbachia and the adult heartworm, we've found that these worms begin to die. They're sick. They don't pass as many babies into the bloodstream, and those babies that are passed into the bloodstream will not become infective to another animal. So we use doxycycline. Every treatment routine that's recommended for heartworm uses at least 30 days of doxycycline, the antibiotic, every day. And that kills the Wolbachia. Then we recommend after the 30 days, there's a 1 month waiting period. And then we start with the first injection. Injection of melarsoline is given in the muscles on the back, or right behind the kidneys, uh, given on one side. And then we wait 30 days. And the second injection is 2 days in a row. So we're doing 3 injections altogether of melarsoline. We treat these animals with cortisone to avoid secondary respiratory problems, because as the worms break up from this treatment, it can cause coughing. We treat these animals, very importantly, we tell the client that restriction of exercise is got to be number one, because as these worms break up, if you allow your dog, as an example, to go running around the backyard, you're moving these worms, these pieces that are dying, and your dog could die from embolism or clot just because of the worms moving around. That's probably the number one reason, that the number one problem we have with compliance with treatment. It's very difficult to take like an Australian Shepherd and all of a sudden put them in a kennel. So oftentimes your veterinarian will give you a couple things to calm the dog down every day. You might have trazodone as an example. There are a number of different types of drugs just to make the dog calm. So because you're going to have to not open the back door and let the dog run out in the backyard or take it to a dog park. You need to keep it on a leash and you need to restrict it. That's probably 50% of success in treatment. And then it's important to understand that over this almost year, by the time you're done with treatment, um, these dogs have a significant amount of damage to the vessels in their lungs. And that damage, we have proven, lasts a lifetime. It doesn't go away. So, but we have a gold standard treatment. And while it's expensive, I would say now, I used to say it costs $1,000 now. And, if it's done the way it's supposed to be done, it will cost a couple $1,000s. But that's, and so therefore, compared to prevention, which might cost you $30 or $40 a month or $50 a month, depending on the size of your animal, there's no comparison in cost. So, prevention is worth a pound of a cure.
Right. Yeah, absolutely. Absolutely, especially in this case.
If that makes sense. I don't know.
Yep, totally, totally.
My suggestion, use a labeled product, get it from your veterinarian. The companies, the pharma companies that produce these drugs stand behind their products. And in many cases, if you're giving your dog a heartworm prevention and it comes down with heartworm, the company will pay for treatment. That's how that's how sure they are that their product is successful in treating heartworm and prevention of heartworm.
And so the best place to get that medication is from your veterinarian.
Well, yeah, if you get it from a veterinarian, or you can ask for a prescription and you can buy it online, as long it's a prescription drug. You can't buy it over the counter. You can't go to, there are certain products, to prevent fleas and ticks and things like that, that you can buy over the counter. And that, I see Costco has them now, and it'll save you some money. But if but I think your veterinarian, if you're is the best person to buy it from. And you'll find that most of them are very competitive in their price. You can't, it's an expensive product to begin with in many cases, but they're competitive. And if you have a problem, they're there for you. It's very hard if you buy it online. And there are plenty of online places to buy these products with a prescription. They're not going to sell it to you without a prescription from your veterinarian. That they won't be available if you need them, if you have a problem. So I think that's very important.
So giving the medication, make sure that you are watching your dog consume it
Right.
completely. Yeah.
If you're giving, watch the dog consume it. And if you're giving it topically, you don't want your dog to jump in the lake right away or go in a pool in your backyard after you give it. You have to wait till it's distributed through the skin. Otherwise, it's useless, you know. Uh,
And so
that's
how
where
long
the
should you wait?
that's where the injectable comes in, because compliance is not an issue. If you have your veterinarian give the 6 month or 12-month injection for heartworm prevention, but again, it only prevents heartworm. It doesn't prevent other things just yet. We haven't seen that it does. Then you have compliance is 100%. You don't have to worry about giving a medication. You just have to worry about the flea and tick control. Like I said, a lot of these are combined with a lot of other things, safe for your dog. But you give the injection, and then your compliance for heartworm is good for that month or
And
12
if
months.
if you use the topical, how long should you wait before bathing your dog or letting them swim? And
At least each, I don't know what each one has on their instruction sheet, but I would say at least 24 hours.
okay,
At
so
least
yeah, you're
24
right.
hours.
That would be on the instruction sheet.
Same
So
thing with if you're using a topical, and you have toddlers in the house. You want to make sure that they're not getting the topical on themselves, hugging the dog and getting the topical. It usually goes at the base of the neck. You separate the hairs and you drop the vial, the liquid in the vial on the skin, and that's dispersed through the whole body. But you obviously have to be responsible and be careful about your kids, and also not making sure you wash it off. Make sure you don't wash it off right away.
right, right, exactly. Lots of great information, Dr. Rubin, as always.
Took
And
up all your time,
no, it's great. Oh my gosh, this is so fabulous to really get a tutorial on heartworm disease. And um, so where can pet owners learn more about heartworm disease? Although you've
I
done
mentioned
such a
it
great
before.
job.
It's heartwormsociety.org. Just go to heartwormsociety.org, and everything that you want to know about heartworm is on there. And there's a veterinarian section, and then there's a pet owner section. And start
Mhm.
out with the pet owner section. You don't need to go to the veterinarian section. And then if you have any questions after reading that, call your veterinarian and they can
Right.
talk to you about it.
Lots of great information. Thank you, Dr. Rubin, for joining us today. It's
My
been
pleasure entirely. And if your listeners and watchers, viewers, need to know more information, go to heartwormsociety.org. You'll find a lot of great information. And don't ever think that it won't happen to your pet, because it only takes the bite of one infected mosquito, to transmit heartworm to your pet.